Thank you. No, thank you very much. I am indeed connecting to you from Gaza. I'm in the central Gaza Strip, about a kilometer south of the Netzarim corridor. And look, it's 11:30 here. We're waking up from another intense night of bombardments, the fourth night of bombardments since the ceasefire abruptly broke down on Monday night. And the situation is gravely concerning. The bombardments that are across the Gaza Strip have led to large-scale loss of life over the past four days. Most of those deaths have occurred at night. The Ministry of Health here is reporting around 600 people killed, amongst those around 200 women and children. So absolutely desperate tragedies that are occurring all over Gaza. Coupled with that, we're seeing evacuation orders. We're seeing large-scale displacement. Lots of people forced to move. Lots of people on the move. Yet again, Israeli forces have reoccupied, moved back into the Netzarim corridor, which separates Gaza City and northern Gaza from the rest of the Gaza Strip. And ground operations, they're being described as limited ground operations, are underway in various parts of Gaza. And just over the past few minutes, the Israeli Defense Minister has issued instructions for further occupation of parts of Gaza. So very much an evolving situation here. And of course, this all comes against a backdrop of no supplies having entered Gaza since the beginning of March, so for about 19 days. So this is the longest period since the start of the conflict back in October 2023, when no supplies whatsoever have entered Gaza. That's supplies of aid, commercial supplies, but also fuel, which keeps everything going here. And you'll recall the reports of the sole electricity line that was feeding Gaza was cut off in the middle of last week. And that immediately has translated into a massive reduction in distributions of essential supplies, food, shelter supplies, non-food items for desperate families, and also a drawdown in services because of the bombardments. It's making it a lot more difficult for people to move around to the distribution centers, to the health centers, etc. And of course, when people are on the move, there always has to be a recalibration of how those services are provided, and that takes time. I'm here in central Gaza. The area around me was empty as of a few days ago, but already people are moving back. People are fearing the worst yet again. And we can say categorically that the progress that we made as an aid system over the 6 weeks of the ceasefire is already being reversed. This is in terms of basic sustenance, but it's also the services that we're providing, and the hope that people have started to have that life was gradually getting back to some kind of routine. And the risks and the fear and the suffering and the humiliation and cruelty that people had gone through over the past 18 months was something of the past. I mean, look, this briefing was arranged or organized about a week ago, and I was hoping to be able to tell you about all the work that UNRWA had done to restore services, restoring primary health care to 200,000 people through reopening of our health centers, and kind of most importantly, restoring access to education for 50,000 young girls and boys at schools across central and southern Gaza. The images, the videos, the life and the happiness in the eyes of the children and the pupils was really something to behold. One of the few positive stories that we'd have been able to communicate from Gaza. But alas, all that is back to naught. Those schools, those learning centers are now suspended. We are able to continue some health services, but it's very, very difficult when the situation is so dangerous for people to move around. And look, we've been through this before. We know how this goes if the ceasefire is not restored. This means large-scale loss of life, damage to infrastructure, property, increased risk of infectious disease, and massive trauma for the 1 million children and for the 2 million civilians who live in Gaza. And it's worse this time because people are already exhausted, they're already degraded, their immune systems, their mental health, people's populations on the verge of famine. We're not starting from scratch here. This is a population that has already suffered so much. In many ways, these are the aftershocks after the earthquakes of October the 7th and everything that's happened since then. It's fear on top of fear, cruelty on top of cruelty, and tragedy on top of tragedy. And the people I speak to, refugees, UNRWA colleagues, they're really feeling lost. Just as I said, as people were starting to hope for their futures, they're back to where they were. They feel defeated. They feel hopeless. They feel yet again scared. The memories that we had from the war of going to bed not knowing if loved ones and colleagues would be safe, would be alive in the morning, all that is starting again, including tragically amongst UN colleagues. As you said, Alessandra, at the start, there have been 7 UNRWA staff have been killed since the fighting resumed, and 1 UNOPS staff member as well, an international staff member in a deconflicted UN property. Our thoughts are with his family, and our thoughts are also with the families of those who were also gravely injured in that incident. But I'll end by saying it's not too late. We can step back from this. We can restore the ceasefire. As you said, as the Secretary General said, we call for an immediate and unconditional release of hostages. We call for protections for UN workers, for medical staff, for all humanitarian workers, and we call for a resumption and an uninterrupted flow of aid so that we can get supplies to the people that need them, so services can get back up and running and we can put this behind us. We've been through this once already. We absolutely do not need to go through it again. We, the parties to the conflict, the powers of the member states, need to do everything to put this to an end before it's too late. Back to you, and I'm happy to take any questions.
Thank you very much, Sam. And indeed, as you said, this is terrible, but also we would like to share